However, when we looked on the full study population, we found a 50% decrease in zero points. So the lower the zero points, the better, the less ataxic are the patients. And in the patients who increased their frataxin expression, we found a 11.5% decrease in zero points. An interesting finding for safety reasons, we also looked for iron parameters because EPO is also involved in hemoglobin synthesis and erythrocyte erythropoiesis. And what we found was a significant decrease in iron parameters, especially in serum iron, ferritin, and serum serum transferrin saturation. An increase was observed in serum transferrin during EPO treatment. But after EPO treatment, so in the washout phase, these parameters returned more or less to the baseline levels. For safety reasons, we also looked for hematologic parameters like hematocrit, hemoglobin, reticulocyte count, etc. And what we found, there was an increase in hematocrit during treatment. This red line indicates the upper range of hematocrit. And in some patients, phlebotomy was performed. So we was performed according to predefined study criteria. So in males, if hemoglobin was higher than 185 grams per liter, and in females when it was higher than 165 grams per liter. And here we see the number of phlebotomies in the different patients. Now to the study 2B. For 6 months, again the study population, which was similar to the first study population of the phase 2A trial. And the frataxin levels in lymphocytes, they increased also with the lower dose of EPO. After 6 months, we found a mean of 27% increase, and the range was 14 to 49% compared to individual baseline levels. And also we could find an increase with time, so from baseline with month 2, 4, and 6 there was increase in frataxin levels in these patients. Now to the neurological outcome of phase 2A and 2B together. So the 3 days ATAXIA rating scale FAS. We found the baseline 1 before treatment to month 6. We found a decrease. The mean was 85 to 50 points, and baseline 2 versus month 6, it was 55 to 50 at the end of the trial, with a significance level of 0.0063 and 0.0106. We looked also on several levels, and there we could find reduction in sera between baseline 1, so before treatment, and after 6 months from 20 to 50 points with a P of 0.0045, and between baseline 2 versus month 6 we found a decrease from 18 to 15% points with a significance of P of 0.0103. This shows the sera measurements during the 6 months during the whole study. So it shows that measurements have to be performed several times, not only one time, because the patients are not always in the same condition. Then we looked also at the oxidative stress parameter, 8-hydroxy with oxyguanosine, and again after 6 months there was a drop in concentration of 8-hydroxy with oxyguanosine. And also the iron parameters, there were changes. Serum iron, creatine, transferrin saturation dropped during the trial, and transferrin saturation increased during the trial. For safety reasons, we also looked on erythropoietic response, which shows the hemoglobin levels of the patients, and one can see that they clearly react with increase in hemoglobin levels. So they use iron for hemoglobin synthesis. For safety reasons, patients also had to be phlebotomized. So from the female patients, one patient had to be phlebotomized, and from the male patients, 3 patients had to be phlebotomized. So what we have learned from the clinical trial, 5,000 units as well as 2,000 units, EPO 3 times per week, were effective to increase frataxin levels. The treatment with EPO showed a significant improvement in ataxia rating scales after 6 months, and this was shown in both ataxia rating scales. There was a significant reduction in oxidative stress parameters. However, phlebotomy has to be included as a safety measurement in long-term clinical trials with EPO. And what is the next step? Placebo-controlled trials will be necessary, as well as post-finding studies, which are already started in Austria. Last, I want to acknowledge people, so especially the patients who participated in the study, and people from the medical university and from the medical university in Innsbruck, as well as from the funding organizations. Thank you.
So, are there any questions specific to EPO?
First of all, I don't know how to understand this with the 3 points neurological improvement. If you could give us some examples, practical ones, so that we can draw our conclusions. Because I don't understand 3 points. What is it? Is it very much? Is it very little? How does this in everyday life? I mean, the movements they do. How do they improve? What can they do now that they couldn't do before? For example, this is one thing. Well, I have more questions. May I ask all of them quickly? The second question is if it has been tried with children and adolescents, and if it could be, if it is safe or not. Well, I finished because I don't know. Yeah, okay.
So this trial was performed only with adult patients, so we don't know how it is with children, because it's easier to make such a proof of concept trial with adults, because they can decide to participate or not. Second was the improvement. So most of the points which were reduced come from improvements in locomotion and in speech.
Locomotion also, so.
Locomotion. That's interesting.
If you have other questions, you can ask, of course.
And the third one is taking